Okay, why don't we just get started here? So I thought I would spend the first couple of minutes just simply introducing myself so that you had an understanding of why I am credentialed to be speaking about bladder health in particular. And I think, it's important to understand that bladder health from a medical perspective is actually captured by two specialties, captured by the urologist as well as gynecologists. For gynecologists, it really falls under an umbrella called urogynecology, which really captures anything in the pelvis. So that is obviously the uterus and the ovaries, but it also means the bladder and the bowel. And so this is where bladder health, fits into the gynecologist's wheelhouse. The other thing too is that often a lot of bladder health can be related to hormonal health, which again falls to the gynecologist. So I've been a practicing OB-GYN for over 20 years now. And really it's been the last 10 years where I have dedicated my career to the Institute for Hormonal Health, which is a practice that I started in 2011, and really focusing my medical expertise in a way that I had never done before. And that was really more about an integrative and holistic approach to hormonal health. So we capture a ton of ground, whether it be stress-related hormonal conditions or menopause, andropause for men, hypothyroidism, gastrointestinal issues, neurotransmitters are a form of hormone. So we cover a lot of ground at the Institute for Hormonal Health and have a team of practitioners that support each other in this practice. But it's really been in this journey of approaching things differently, where I became aware of several different technologies, and EmSella, which we're going to be talking tonight, being one of them, that are real game changers. But for me, it's not just about having amazing technology. My philosophy is all about stimulating the body to heal itself. And so EmSella falls into that category as well. So, I think, really my eyes have been opened in many ways over the last 10 years to things that can be done and done differently and very effectively. Along with my day job, I'm also an assistant professor at the University of Toronto. I'm medical advisor to In Common Laboratories, and I'm an assessor and educational supervisor at the College of Physicians and Surgeons of Ontario, as well as I sit on the review board for the Integrative Healthcare Practitioner Journal. So tonight we're going to be talking about BTL EmSella. So BTL is the name of the company that makes EmSella. And if we break down EmSella and its meaning, the EM part of it stands for electromagnetic. So what we're talking about here is a high frequency focused electromagnetic technology. And Sella means saddle. So electromagnetic saddle, or an electromagnetic chair that is used for urinary incontinence. So I wanted to touch, on the impact that incontinence can have for women, because, there's really an entire spectrum of how this can impact for women. And you may fall on one end of the spectrum and not appreciate that things can actually deteriorate further. But I think this will just give us a sense of how big a problem this really is. And one of the important things to understand is that up to 23% of women will take time off because of their incontinence. So in other words, women that have that severity of incontinence, it can be a big deal. So a big deal for the individual, and certainly a big deal for an employer as well, right? So another interesting statistic is that a severe case of incontinence, a woman can spend up to $900 a year on incontinence routine care. So that's basically pads. And I can certainly tell you that there are other ways that I would rather be spending my $900 than on incontinence pads. And I think too, it doesn't take very long watching TV to see all of the advertisements on incontinence pads, making us sort of believe that there isn't anything else that can be done about it. And there really is, which is one of the reasons why we're talking about this tonight. Between 25 and 50% of women who have urinary incontinence also experience sexual dysfunction. So there is an overlap between the two groups. But what I would say too is that sexual dysfunction often tends to be a little bit more complicated. There's usually many potential reasons for sexual dysfunction, but one of them does go hand in hand with the urinary incontinence and the strength of the pelvic floor. So that's something that we'll touch on briefly tonight, but there is quite an overlap, and important to know that. Another thing is that about a third of women experiencing incontinence between the ages of 45 and 50 actually avoid athletic activities for fear of having an incontinence episode. You know, the chunk of my patient population is in that 45 to 55-year-old window, and oftentimes it's a bit of a perfect storm from a hormonal perspective. We've got the obvious changing fluctuations in hormones as we approach menopause and go through menopause. But then there's the whole underlying stress-related phenomena that a lot of my patients aren't aware of, but is so foundational to hormonal healing. And so, you know, when we consider that and the importance of remaining active during this period of time, it's really kind of a double whammy for these women that are avoiding athletic activity because of this concern of incontinence. So who is this webinar for? Basically, if you're experiencing leakage of urine, if you have any urgency of urination, which basically means you got to get to a bathroom in a hurry, you have experienced frequency of urination, or if you have mild prolapse. So prolapse is a fairly common condition, and it's basically where the pelvic floor isn't as strong as it used to be, or it's being damaged, whether it be by pregnancy, a rapid delivery, a long delivery, a forceps delivery. And then you add to that the lack of hormones as we go through menopause, and often things can start to push into the vagina. So when I say things, I mean the bladder can push into the vagina, the uterus can descend into the vagina, and the bowel can push into the vagina. So those are three different types of prolapses, and sometimes they happen in combination. It can create a dragging sensation or a pulling sensation in the vagina, and can, for some women, make it challenging to empty their bladder and evacuate the bowels. So there's varying degrees of prolapse, and certainly mild prolapse falls into the category of what EmSella can manage. So who is this webinar not for? Well, if you're experiencing vaginal dryness, painful intercourse, or recurrent bladder infections, EmSella is not necessarily the best tool for that. Having said that, all of these three symptoms are definitely things can be done about, and is actually a big part of the work that I do at the Institute for Hormonal Health is working on this sort of cluster of symptoms, which we call urogenital atrophy. And for me, you know, I don't know, weirdly enough, it's an area where I have a lot of passion around, because there's a lot of really amazing cutting edge technology that can be used now that is largely overlooked in the conventional world, and yet is making big waves. So just because it's not for you doesn't mean that it can't be managed. Who can not use EmSella? Well, kind of goes without saying, pregnancy. We tell all pregnant women not to do things that they don't need to do with their body, so there's no difference with EmSella. Those that have certain medical conditions like pulmonary insufficiency, cancer, heart disorders, bleeding disorders, blood thinners, you'll see how this technology works is that it really does get blood pumping around the body. And so there's just some certain medical conditions that are probably best if it be avoided. People who have a cardiac pacemaker or an implantable defibrillator, neurostimulators, metal implants, or for that matter, a copper IUD. These all have metal in them. And because we're talking about magnetic technology, we certainly don't want to inadvertently remove your copper IUD and, or for that matter, mess up a pacemaker. So those are the big things that are contraindicated with EmSella. So what is it that I actually see in my practice every day? Certainly from a bladder health perspective, one of the most common conditions we see is a stress urinary incontinence. And then there's another form called urge incontinence, and then there's a mixed incontinence, which is a combination of the stress incontinence and the urge incontinence. So the stress incontinence is where you experience the leaking of urination with laughing, coughing, sneezing. So anything that increases the intra-abdominal pressure and puts pressure on the pelvic floor can result in a leakage of urine. Now, I would say most of my patients, they talk about leaking less than a teaspoonful of urine. But the reality is too, if you think about it, if you're active, playing tennis, for example, a tennis match, a small amount, less than a teaspoon of urine over a tennis match amounts to a lot, or 18 holes on the golf course can amount to a lot. And so that can be definitely a challenge for a lot of women. So that's the stress urinary incontinence. The urinary urgency is really, it often sneaks up on you, but there are also sort of classically some triggers for a lot of women. So you get home, you put your keys in the door, and then all of a sudden you've got to go. Or you hear running water is another trigger often for women. And so that sudden urge to get to the bathroom can really be overwhelming. And a lot of women can make it to the bathroom, but if they don't find a bathroom, sometimes it's a little bit of urine, and sometimes women empty their entire bladder and it's beyond their control. So again, you can see there's a whole spectrum of range of what this can present as, but certainly disruptive for a lot of women. Urinary frequency basically means that you are emptying your bladder more than every 2 hours. And again, that falls under the urge incontinence piece of it, as does nocturia. Nocturia, by definition, means that you're up more than twice overnight to empty your bladder. Now, I would caution you, because I deal a lot with sleep disruption. That's often an underlying hormonal issue. It's really important just to ask yourself the question, are you being woken up in the night because your bladder is giving you the sensation that it needs to be emptied? Or are you waking up and because you're already awake, you might as well go and empty your bladder, because those are two different mechanisms. So if your bladder is waking you up in the night and it's happening more than twice, then that is considered abnormal and it is considered too much. So how do we manage these symptoms, and what are some of the things that people use? And I've got on this list sort of basically 4 examples, and I'm not suggesting at all that these are useless an approach to urinary incontinence, because in fact all of them have their place. Kegel exercises, I think most of us know, that is basically contraction of the pelvic floor. And contraction of the pelvic floor is important, and absolutely, can you take somebody from being incontinent to being continent within 3 months? Absolutely. Does it require dedication and commitment and religious Kegeling? Yes. And so therein lies the challenge. There's a couple of things about Kegel exercises. 1, not everybody can Kegel. 2, to do a proper Kegel is actually more involved than one might think. And 3, and probably the most sort of rate limiting step to Kegel exercises is actually people doing them reliably and consistently. And so that's really the limitation of Kegels. Again, they are of value, but practically speaking, a lot of women just don't do their Kegels. Pelvic floor physio. Absolutely, Canadian trained pelvic floor physios are very talented, and they can be used for a lot of different things and not just bladder health. So definitely not dismissing pelvic floor physio. And in fact, I've had a conversation, and keep in mind, this is me as a gynecologist, with a pelvic floor physio who explained to me how a proper Kegel is actually done. And so my idea of doing Kegels at, a stoplight, being efficient with my use of time, isn't actually really very helpful, because in order to do a proper Kegel requires a coordinated effort and actually requires some focus. So doing it at a stoplight is probably not the best place to do it. But again, pelvic floor physio, there's absolutely a role for it. One of the things is they can teach you to do a Kegel properly. And the question is how good, again, are people at following through with their Kegels? Vaginal weights. So yes, they're just like any muscle in the body. You can do weight training with the vagina, and vaginal weights come in all shapes and sizes. They have eggs and they have balls, and they come in quartz or jade, or I don't know. There's all sorts, and basically it's basically a weight that is put into the vagina, and then a Kegel to hold onto it, and you can graduate. So I got a dog undressing in the background here. The Kegel weights are meant to strengthen the pelvic floor, and again, they work, but they also require commitment, just as Kegel exercising does as well. The final thing that I have on the list is medications, and medications are often used for the urge incontinence piece of the puzzle. And the medications, they work okay, but I would say the number one reason why men and women don't like the medications is because almost universally one of the side effects is a dry mouth. And although a dry mouth doesn't sound like a big deal, it can be really pretty miserable. And if it's the number one reason why people stop this medication, you can appreciate that, yeah, that has its limitations. So yeah, I'm not necessarily the biggest fan of the medications, but again, there's a role. So this next slide here gives you an idea of what the EmSella technology looks like. So the two images on the left is, you know, a woman sitting on the device. I can assure you the pose in the middle is not how you sit on EmSella to get at the pelvic floor. Neither really is the one on the left, but it's closer. That chair that we're looking at, in the base of it is basically a giant magnet. And that magnet is the electromagnetic technology that is doing the work and causing the pelvic floor to contract. Now, the positioning, sitting on the chair, anatomically, we are all slightly different. And so we do have to position ourselves to maximize the actual effort of the magnet. And so, you know, the technologist that can assist you will help you orient. But again, it is a matter of just finding the sweet spot, for lack of a better term. So yeah, I think the importance of these slides is really to appreciate that you can do this fully clothed. You know, it is not a regular gynecologic exam. There's nothing going in the vagina, and I can fully appreciate, as a gynecologist, coming to see me is probably not the highlight of most people's day, no more than the dentist. In fact, I don't know, might be you know, less desirable. But this device, no, fully clothed, no pain, nothing going in the vagina. It's pretty straightforward and easy to do, and you know, it's just amazing technology that it is just that simple. So how does it really work? Well, I think it is important to have a bit of an understanding of the pelvic structures. So what we're looking at here is basically a slice through the body and then looking at it from the side. And so in the pelvis, you know, on the left, we see that yellow ball. Well, that's the bladder, and you can see the urine that's leaking out below. On top of the bladder and behind it is the vagina and the uterus. And then to the right is the rectum, and then you can see the spine and the tailbone. They've nicely highlighted the muscle in red, but it's a little bit deceiving when you look from this angle because it looks like it's a single, you know, little strip of muscle. In fact, it's important to know that the entire pelvic floor structure is like a hammock. So there's everything from, you know, side to side and back to front that is supporting those pelvic organs. And so when they aren't adequately supported, we can get leaking of urination, you can get prolapse, and the challenges that go along with both of those conditions. The actual magnet in the chair is what's stimulating the pelvic floor muscles to contract. But that magnet it's really big. And not only does it create a perfect Kegel, which again can be hard for many of us to do, but also a supramaximal Kegel, which none of us can do. It basically is creating such a contraction of the pelvic muscle that it's lifting the pelvic floor, and it's also training the neuromuscular aspect of supporting that pelvic floor. So a perfect Kegel, a supramaximal Kegel, and the equivalent of 11,800 Kegels in a 28-minute session. So you can appreciate that why after 6 sessions, the pelvic floor would be that much better supported, right? And so this is really when you have supported that pelvic floor, it just tucks everything away and puts it into a better position, provides better squeeze to the pelvic floor, and the consequence is basically continence, of course, is the major objective. But the other thing that's important to understand too is that when you have that many contractions of the pelvic floor and you are driving that much circulation to the area, it's not just to the muscles where that blood supply is going, it's to the whole region, which is why one of the side effects of EmSella is often an improved sexual response as well. Now, again, it gets a little bit complicated. There are reasons beyond just lack of blood supply to the pelvis that can impact sexual dysfunction. But this is a nice side effect. And in actual fact, the sexual function part of this was really discovered after they had designed it for strengthening the pelvic floor. But now they have an additional setting that can target the sexual enhancement piece of this. But again, it is a side effect when you're working on the bladder, is that for some women it does enhance that sexual response as well. So what we're looking at here is a split image of an ultrasound of the same person when their pelvic floor is relaxed and when it's being stimulated by the EmSella. So basically the big black circle in the middle is the bladder full of urine, which is why we can see it and it looks dark the way we do. And then below the dots at the bottom are the pelvic floor muscles. So we can see on the left-hand side, that's a pelvic floor that is slack. And then on the right-hand side, you can see how it lifts to meet the dots. And that's basically what the EmSella is doing, is it's creating that big contraction. So just to reinforce, there's no probe that's involved here. It's not radiating in the typical sense of that term. Non-thermal basically means it doesn't heat anything up. And the technology is what we call non-ionizing, which is basically another way of saying it's the electromagnetic technology. So, this EmSella, as I was saying, when you line yourself up properly, it's targeting the entire pelvic floor. It's not just one muscle in isolation, it's capturing the whole thing. And again, important to know that it's fully clothed. Loose clothing is generally the best to show up in. It doesn't mean that it doesn't work throughout, but just generally removing any layers between you and the magnet can be helpful. So what is the time commitment for this? Basically, each session is 28 minutes long, and the initial series of treatments is for 6, spread out over a 3-week period. So basically twice a week for 3 weeks with half-an-hour intervals. So this slide is really a reflection that there's been 5 clinical trials done on EmSella, and I think the most notable finding is that there was a very high patient satisfaction rate, and they were really looking at quality of life parameters, because this isn't, a life-threatening issue or concern, but I'll tell you, it can be very disruptive to quality of life. So a 95% satisfaction rate is really very substantial. The other thing that they found, a lot of times the studies that are done in gynecology looking at urinary incontinence, they actually weigh the pads. And so it's a way of objectively quantifying. But in this particular case, it was, speaking to the individual and what was the overall reduction in pad use. And that was EmSella, for individuals with severe incontinence could reduce it by 2/3 of their pad use. Again, there are plenty of women that if there's a small amount of leaking, you can take them to be completely dry. But there are also, women will take great satisfaction if they're used to, really leaking, kind of any bit of improvement as well. And that's, I think, one of the reasons why you're seeing such a high satisfaction rate, is that it really can make a difference. And in tying back to that $900 annually, right? So there's a cost savings there too. So these are just some testimonials that I think really kind of highlight the important parts of this. And this one is saying, like, what it does is kind of take the place of Kegels, which a lot of people don't have the time or energy. And quite frankly, it's uncomfortable to sit down and do Kegels. Well, I don't really know how uncomfortable it is to sit down and do Kegels, but I would agree that it does require time and energy. And it's just, practically speaking, most don't do it. The most important thing to take care of in our life is urinary incontinence, but it's the other part of it that makes our life a little more enjoyable. So that's the sexual response part of it. And as I say, there are settings for that specifically, but a bonus to just dealing with the bladder is the sexual enhancement. It's freeing, very freeing to be able to do what you want to do again. And this speaks to the quality of life aspect of it, right? If we're limiting, the working, the exercising, all of that sort of stuff, there are plenty of women that map out the bathroom, around town, and they know exactly where they need to go. And that's just, I don't know, it's annoying at best. Okay, so on to the Q&A. Anybody have any questions? Okay. Okay, so we've got here, I've had 2 bladder surgeries. Would EmSella be helpful for me? Yeah, bladder surgeries, it depends on what type of bladder surgeries have been done. A lot of times it's what we call an anterior repair, where basically we are snugging the fascia layer, the strength layer beneath the vaginal tissue, just to push and support the bladder back into place. And those surgeries sometimes aren't very successful because the tissue is kind of crappy to begin with. And so when you try to operate on crappy tissue, it's still crappy tissue. And so often they can tear down. So yeah, it can certainly help for, you know, some bladder surgeries. It depends on the degree of it falling into place. There's tension-free vaginal tape procedures too, which is like a sling. So that's another type of surgery that can benefit from positioning the bladder back into place using EmSella. So I would say, yep, that's certainly that EmSella can play a role in that. Can it help with somebody over the age of 80? Yeah, absolutely. You have to use slightly more gentle settings. You know, it's no different. The pelvic floor muscles are no different than any other muscle. And of course, as we age, there can be deterioration. So you just have to be easy and gentler. The nice thing about EmSella is that you can actually control the intensity. And, you know, the whole idea is to, you know, make it as high as you can, but within comfort level and without pushing a muscle too far. So at 80, yeah, I would probably have different settings, you know, than I would in a, you know, a 40-year-old. How long do the results tend to last? Yeah, a great question. I would say most of my patients are probably back in for a touch-up, and not necessarily a whole series again, but somewhere in the 6 to 12 month mark where they come in for a single touch-up. But again, it depends on what else you're doing for the pelvic floor, right? So if you continue on with your Kegels, you'll probably stretch more out of your results. You know, sometimes I introduce hormones, whether it be systemically or into the vagina, and that can help, you know, support the results to last a little longer. So there are other things and other devices for that matter that can bridge that gap as well. Okay, so the question here, how does a woman know for certain if she has mild prolapse? Mild prolapse can be tough if you're not experiencing any symptoms. So the symptoms can be, and not everybody does experience, but sort of a dragging sensation in the vagina, a pulling, a weight, a heaviness, as though things are falling out. Generally, though, that tends to be more of a moderate to a severe case of prolapse. So the only really way of knowing whether and confirming whether somebody has a mild prolapse is with examination. And so family doctor can do that if they're comfortable doing that, and or a gynecologist can certainly assess. But it really comes down to if it's really bothering you. So if part of the prolapse is a leaky bladder, then yes. And if the symptoms of that dragging fullness sensation, then yes, EmSella works as well. Is mesh from an umbilical hernia repair okay? Yes, it is. There's no problems there as long as there's no metal implants, and the meshes from that surgery do not have metal in them, so that's good. What is sitting on the EmSella chair like? Excellent question. It's a hard surface, but not an uncomfortable surface. You do have to orient yourself again to maximize the exposure of the pelvic floor. So it takes a little bit of adjusting in the beginning to get it right. And again, that's with the guidance of a technician to help you. It is, it feels like a little bit of a contraction, but certainly not uncomfortable. And again, you can adjust the dial and you build on the intensity of it. For me, I definitely didn't experience any pain. And in fact, I've had patients who find it quite pleasurable. And in fact, there's really two phases to the EmSella. There's the contraction of the muscle part, and then there's a part two, which feels like a little flicking on your behind that is meant to tap out the lactic acid. So just like when you work out at a gym, you can get accumulation of lactic acid in the muscle, but by doing that tapping sensation, alternating with the contraction, eliminates that soreness. There's no soreness of muscles afterwards. It's definitely not painful. Can EmSella be used if S-string is inserted? Yeah, it can be. I suppose it's possible that S-string might come out with it, but that's easy to put back in, and there's nothing magnetic in S-string, so yeah, that's fine. Okay, how much does it cost for the full treatment? Yeah, so a typical treatment is, upfront is those 6 sessions. So that's twice a week for 3 weeks, and they're 28 minutes each. And so a full series of treatments is $1,800. And so there's the deal that's happening with this webinar where you can get the 6 for the price of 4. So that's a $600 saving, if I've done my math correct. Okay. And is this treatment covered by insurance companies? Yeah, it is for some, but not entirely. It really depends. So many of the insurance companies have their own, ideas about what they will cover and what they won't. So yeah, you could try running it through an insurance company with a letter from a physician and see if that works. Yeah, here's the EmSella offer up here. So basically, for the price of 6, for the price of 4. Yeah, and certainly if you've got any further questions and you want to reach out to our team, we'll be providing you with that information to contact, and can go over some of the details as well. And yeah, any other questions? Are there side effects? Is there a link to more information about results by age, activity level, etc.? Yeah, there are side effects. No, I haven't had any patient that had any issue with it. Again, if you're carefully selecting the patient, so in other words, you don't have any of those contraindications to it, there really shouldn't be a problem there. Again, it's not no pain, and again, too, right, you can control the dial of it. As far as any other concerns, no. I mean, there's a few women who, but again, you can identify them in advance, who already have a very tight pelvic floor. But again, that requires an examination. And is there a link to more information about the results by age, activity level, etc.? The BTL website does cover some of that information. How much detail, like right down by age and activity level, etc. I haven't seen that kind of detail. And where are you located? Yeah, so the Institute for Hormonal Health is in downtown Oakville, and it's just north of the lakeshore on Trafalgar. Any other questions before we tidy things up here? Okay, so that sounds good. Thanks everybody for attending, and hope to see you at the Institute for Hormonal Health. Take care. Have a good night.